excited that Snigdha is here, and Michael will introduce her in a little bit. So, first of all, I just want to thank you all for being here. Thanks for carving out some time on Friday morning. Do Friday mornings work, or like any day other than Tuesday mornings work better, basically? That's kind of the feedback you got. So I'm glad you're here, glad you carved out some time on Friday mornings. And it's going to be a beautiful day, so if you decide to blow off the rest of the day, that's on you. I want to thank our community supporters that make this possible. All these events, like between our community supporters and our event sponsors for some of our sport events, this is how we make these things work. So if you see anybody that's a community supporter, especially out in the community or if they're in their group, just remember to say thank you to them because they're making some of these things put together. I'm super happy to be hosted here by Versique. John Knott is our Versique guy. John, you want to come on up here, just say a few things about Versique real quick and welcome everybody into your home.
Awesome. Well, that's what I was going to say. Welcome to our home. We appreciate having you guys here and having a little energy here on Fridays. Not too many people here on Fridays. First, logistics. We got coffee that day. Everything runs out. You tell me. I'll try not to screw it up. Bathroom's right around the corner from where you came in. And then just quickly about Versique. Most of you probably have seen our name. Versique, but we're a traditional search firm. So three main areas: executive search, direct hires, like traditional headhunter, perm placement, and then interim solutions. That's where my team plays. So all I'm doing is helping companies when they have shorter needs around finance and accounting, but also doing HR as well. So companies or people that are looking for opportunities, I'm also happy to connect them with. It's not my role, connecting with others in this office that can be very resourceful as well. So great, that's it. Appreciate you guys coming.
Thank you. I probably won't wrap up at the end because we'll just probably let it out organically happen. I want to thank our team, Emily and Brenda, for making this thing happen. This looks good. And then Mike Jones, EOS Implementer, is our partner in this. He's the brainchild behind a lot of these ideas. He hooked up with Snigdha, which was awesome, and got her enveloped into the community a little bit and coming for the day. So I'm thrilled to have Mike doing this with us. It takes a little bit of weight off of our shoulders because he's the genius behind the ideas, and then we just make it all happen. Mike, come on up here, say a little bit about yourself, introduce Snigdha. Let's get started.
Yeah, thanks for that.
Hey everybody.
So yeah, as Aaron mentioned, I have a keen interest based on my entrepreneurial background in the fitness industry and then overall wellness. And the philosophy that I live my life on and I teach my clients and friends and family members is prioritizing your health and wellness should be number one because it allows for you to be better at everything else. So take care, kind of like the airplane, take care of yourself first so you can help others kind of thing. I really, truly believe that. And then what we've been introducing is different concepts, different disciplines throughout the year that can help people dabble, see if they're interested, get more information. Well, this one today is very special because this is a universal one, sleep. And I would argue sleep is the most important thing you can do for your overall wellness and overall performance. And so like most professionals I know who have kids, have businesses, and are trying to balance everything, you're always trying to figure out how do I perform better at work? How do I focus? How do I be present with my kids? How do I learn how to have fun? The number one answer for all that, like the best drug you can take is a good night's sleep, right? So I'm really excited about Dr. Sagar being here. We met we were trying to figure out the exact date. We're going to call it 10 years ago. She did a talk back at one of our CrossFit gyms. It was awesome. And I was excited that she was willing to come join us. It's very special. She's a doctor of medicine at the U of M. And so her expertise and knowledge is one of those things that she's forgotten more than any of us will ever know about sleep. So it's a really rare opportunity. And I'll just leave it at that. So please welcome Dr. Sagar.
Thank you. Thank you for the introduction, Mike, and thank you for inviting me to give this talk. Good morning to you all. As Mike and John all have mentioned, it is a beautiful day, sun shining, abundant coffee, there's no shortage. college, and we are wide awake, and it is Friday. And sleep is important. I'm very happy to speak to you all. My talk is not going to be a too long, lengthy one, probably like 35 to 45 minutes, and I want to open it up so that you can ask me all the questions that you have, and I hope to be helpful in answering all those questions. And you can even ask Mike Jones. You can share my email address if you would like to have any questions at any point another time other than today too. Welcome to ask me. I'm happy to help. So I'm an associate professor of medicine in the Department of Medicine at the University of Minnesota, and I practice sleep medicine. I have passion for my field, and sleep medicine in general is still an evolving field when you compare it something in neurology or endocrinology or cardiology. It's a multidisciplinary thing where you're not only looking at the brain with the sleep, you're also looking at its impact on the different organs in the body and how all the body functions are all linked to it. So there is still so much research needed in that field and still continuing. It is a developing and evolving field. So we are still in the baby era. That's what we would consider that as. So sleep matters for everyone. Just like we all experience, I experience that, so does Homer Simpson. Goes to bed, wide awake. I shouldn't be probably sleeping. Maybe I should be doing something else. Maybe I should change my logo. Maybe I should do something else tomorrow morning. Maybe I shouldn't have taught something last evening in that meeting. I should have done this. I should have done that. We all do that, right? We all do that. I am talking to you all about how you improve sleep. I personally do that too. In fact, I might go to bed thinking that, oh God, I have to do this grant submission, or I have a talk to give, or something like that, or my clinic, or my teaching, whatever. And then I should have met with somebody and emailed somebody and I forgot. So it's a common phenomenon. But what we want to know is sleep is essential and it matters for everyone. So during today's talk, I'm going to focus on 4 different entities. What is sleep? And why is sleep important? How much sleep do we need? And how do we optimize our sleep? So, what is sleep? Sleep is a dynamic process which is generated in our brain with those neuronal connections, and it is regulated by the body circadian rhythm, and it is a cycle. Basically, it's a rhythmic cycle and process where we go through different sleep stages. So we go through non-rapid eye movement sleep, the NREM, and that non-REM sleep constitutes about 75% of your total sleep time. So the rest of the 75 is the non-REM and 25 is the rapid eye movement or the REM sleep that people call as dream sleep. In the non-REM sleep, we have lighter and deeper sleep. And the lighter sleep in the non-REM is the N1 and the N2. And N1 and N2 are lighter stages, and N1 is something that can be up to 5% of your total sleep time, and sometimes people are aware of what's going on around, some conversations, and they are not like fully asleep, their eyes are rolling, but they are not completely into that sleep yet, and they can be easily disrupted and woken up. N2 is still in between the deep and the light N1. And N2 constitutes 50% of your total sleep, and in that N2 sleep, we have what is called as sleep spindles in the brain activity that has an important function in memory consolidation. which is the deep sleep. That is probably, you must have heard this word deep sleep. If people are using the wearable devices and the sleep trackers, they refer to deep sleep when they talk about that. Deep sleep or the N3 accounts for about 15 to 20% of your total sleep time. That is an important sleep in order to feel rested the morning when you wake up. So if people, supposing you have somebody with chronic pain or chronic illness where they have a disrupted sleep, they often have deficiency of deep sleep. In fact, we have like this multidisciplinary approach. When a patient goes to a pain doctor for chronic pain, they would also say, how is your sleep? Because if you get a good night's sleep and you get a good amount of deep sleep, there is a theory that the pain perception could be altered. So maybe the patient may not experience the pain and deal with it the same way. And maybe their energy levels are going to be better. So they're all like very intricately linked. REM sleep is the vivid dreaming sleep, the 25% of your total sleep. And that is where people really dream. It can be really clear, but it is important when terms come to memory consolidation. And when we have memory consolidation, I also want to bring a small point here. Negative memories versus positive memories. How many in this room do you think remember your positive memories versus negative memories? So, is it positive or negative? Which one? Both. Some do negative, particularly those are the people who may be somewhat depressed. Doesn't necessarily mean a clinical depression. Negative memories are stored in the brain structure called amygdala, and that is very strong and it is easily retrievable as opposed to a positive memory that can slip off. How often are we thinking, oh, I did such a good job. Oh, I didn't do a good job. You know, like it's a common phenomenon. So REM sleep is very important for memory consolidation. So like I said, each and every single sleep stage has its own importance. So every single sleep is important. And a good healthy sleep is that rhythmic cycle where the individual goes to a rhythmic process, starting off with the lighter non-REM sleep, getting into the deep non-REM sleep, and ending with the REM sleep. And that normal sleep would be 5 to 6 cycles of these sleep stages, each one approximately lasting for 90 minutes or so. So, why do we sleep? Why is it so important? Why Mike Jones just said that sleep is so fundamental? Yes, it is very fundamental, as I said, for different organs of our body. And decades ago, there have been so many theories that were put forth to know and understand why we really sleep. Each of them have a different perspective. The ideas are totally different, and there are still more theories coming out. But till today, if one knows 100% the reason, no. We still have not discovered the whole thing and the truth yet. But I'll just tell you a few theories and simplify it for you guys. Inactivity theory. What in that theory the idea is certain animals, creatures, tend to be sleeping and inactive in the night. And that was perhaps an evolutionary process, because if they were to be sleeping in the daytime, perhaps they would be attacked by other animals and die as preys. So by sleeping at night, they are protecting themselves from being exposed to the predators. So that's one thing. And the next one was energy conservation theory. Sleep is one of the functions of that is to conserve the energy, decrease your energy demands, particularly during certain times of the day and the night, where your effectiveness or efficiency to procure food or something like eating and all that stuff, we don't have that much of energy. Sleep is a time where your function, the physiological process decreases by at least 10%. Nothing stops, everything continues, but at a very low pace. And that is one of the things that we are conserving our energy to function during the day. The next one is restoration theory. When I said restoration theory, I just remembered restoration hardware. It's not like that, but the restoration, what they mean is it is important for cell reinvigoration or sort of a regeneration of the cell life. It's important for muscle repair, tissue growth. Some hormones like growth hormone are specifically produced only during the sleep. So all of those things are being restored. So your bodily functions. So you want to give your organs a little bit of a downtime, so they're working so hard all along when you're awake. So a little relaxation so they can be fully active and charged for the next day. Brain plasticity theory. That is that there is neuronal organization constantly happening, lot of synaptic activity constantly happening, and so much of that is happening when you're sleeping, surprisingly, which you're not even aware of. Why do babies sleep long hours? Why do you want the babies to have a good night's sleep and long sleep? Because that is when their brain develops and improves with memory and all these things. So these are some of the things. I do not want to bore you by talking more, but still work in progress. Why is sleep important? Sleep is fundamental to our health. It's just not the sleep quality. Both sleep quality and sleep quantity are both equally important, not only for your heart health, but also for mental health, cognition, memory consolidation, immunity, reproductive health, hormone regulation. So what are some of the consequences of inadequate sleep quality or insufficient sleep? It can have adverse effect in so many ways. I'm sure I have experienced, and some of you all also at some point or the other have noticed, though when you're young, you can get away because your energy levels are different, you have the strength and the stamina, you can do work 20 or 24 hours. Doesn't matter, you can do it because you're strong. But it changes as a person ages, the responsibilities and the phases of life, aging and work responsibilities and health issues, all those things impact your sleep quantity and sleep quality. So the commonest thing that I would say more than all this is dysfunctioning of the daytime for the performance for the person. Decreased sleep quality and quantity can impair your daytime functioning. It can make you feel not rested when you wake up from your sleep, and you really want to feel good when you wake up, right? You don't want to feel that, I don't want to get up, I just want to sleep. You don't want that because you have things to do. I mean, this is your life, you have to do. You just can't sleep all the time. So that's number one. Then fatigue as the day goes by. So the energy levels decline. And there are sometimes in jobs, a certain particular hours that are important that you have to be really alert and awake. And sometimes maybe that meeting is somewhere in the afternoon, like 3 o'clock or 4 o'clock, and the person is not really that energized. The energy levels start declining in the afternoon hours after lunch and stuff like that. So it can impair the energy levels, causing fatigue. And it can cause excessive daytime sleepiness. So it can be a simple thing like dozing off during meetings, but it could be even catastrophic like dozing off or sleeping behind a wheel and getting into motor vehicle accidents, harming yourself and somebody innocent. Or it could be something with quality of work, the efficiency at which you're working that can impact your job and your employer's impressions and those sort of dynamics. So that is the most important thing that I tell my patients to focus on. If you think about that, how important it is day to day, how you feel, how you do during the day, then you do all the things that will improve your sleep. And the It affects the muscles of the heart that are pumping and contracting to allow the heart to function. So if we do not have good amount of sleep, less than 7 hours, if it is even less than that, like less than 6 hours, there is a very good impact on the heart where the person can have vulnerability or a higher predisposition for high blood pressure, heart attack, heart failure, heart arrhythmias, which could be the simple things like that little extra beat, people call it as PAC and PVC. It's called premature atrial contractions and premature ventricular contractions, like ectopic extra beats. Some of us have it. It can come sometimes like randomly. It can be very non-specific. It can be because of caffeine if it is taken excessively. But the arrhythmias that I'm talking are like very complicated because these arrhythmias are affecting a long time of the person's life and impacting them. They'll have this discomfort, they'll have short of breath, they won't have good energy, and some people have chest pain with certain type of arrhythmias. But the commonest one they studied extensively is atrial fibrillation. People call it AFib as an acronym. So AFib, there has been so much of research that if you don't have enough sleep and if you don't have a good sleep quality or have an underlying disorder like sleep apnea that is not treated, there is a high chance of recurrence of the atrial fibrillation in those patients, in spite of them having been diligent about all the cardiac visits, have undergone all the cardiac procedures, including cardioversion or ablution and things like that. And then the next one is the hormones. This is the pancreas. So sleep can affect hormones in multiple ways. It's not just a single hormone, multiple hormones. The most impact with the less sleep quality and quantity is going to be the burden on pancreas. It can increase your blood sugar levels, causes increase in insulin resistance, predisposing the person for impaired glucose tolerance and diabetes mellitus. And we know diabetes is a chronic disease and it can affect the micro, small, tiny blood vessels in your body and literally have negative effects. The whole body can be affected with the diabetes. And nerves, memory, consolidation, all those things, cognition. There has been an abundant research in the last decade about cognitive impairment and poor sleep. Sleep is one of the periods physiologically where in our body that there is a pathway called glymphatic lymphatic pathway where there are metabolic waste and toxic substances in our brain that tend to be cleared off. So it's like they are being flushed off. And that will help us with our memory and cognition. But when you're not sleeping enough and not having a good quality of a consolidated sleep, you're not going to be able to wash them out. What is going to happen then? They'll stay there. They'll accumulate. And what will happen when they accumulate? They build plaques, like the amyloid beta plaques. Those are the ones that ultimately cause step-by-step decline in the cognitive function. It can be just a mild impairment of cognition, slowly can progress towards dementia. And there has been studies shown that improved sleep will definitely improve the cognition. It's not going to reverse the dementia, but at least it can decrease the progression to impaired cognition, like severe conditions like dementia and all that. And that is exactly why we say the sleep is very important. American Heart Association not too long ago has expressed and given the advisory that sleep is one of the 8 essentials of life. So it's not only the cardiologist who's going to say that sleep is important. Your primary care, when you go to the dental office, or you go to any other medical facility or anything, anywhere, sleep health is very important for your heart life and your overall life and health. So we spoke about how important the sleep is. We talked about quantity and quality of sleep. How much sleep do you think we need? night. However, there are people who are just fine and just do fine with just getting 6 hours of sleep. You ask them to sleep, they try everything, they still can go to bed any early than they can. They cannot wake up any sooner or later than they can. So those things are all fixed and they are fine the way they are. On the other hand, there are also long sleepers for whom just the 7-8 is not enough. They want to be rested, they feel that I need that 9 hours. Are they abnormal? No. That is how their body is. That is how their neuronal pathway, all those circadian rhythms are all set. And it functions well for them as long as it is okay with their work schedule, responsibilities and all that. But healthy sleep means the duration should be appropriate for the individual. So 7 to 8 hours of sleep, appropriate duration, you're not going to go wrong with that. Good quality, so it's not the time that you're spending in the time awake or struggling to sleep. It is the time that you're asleep while you're in the bed. That is the one that is important. Appropriate timing, going to bed and recognizing your bedtime when you are really that the brain clock is wanting you to do rather than going against it in an opposite direction. Recognize when, like for example, you have somebody like 9:30, they watch TV and they feel like dozing off and they still want to watch the TV. They'll watch that news and all that. I tell my patients, never watch news before bed. Everything will be there for next day, right? You have the next day morning news, you can read them all. So you're recognizing at 9:30, then just wind up, get preparations going to go to bed. Don't wait till an hour to finish the news and then go to bed. So appropriate timing is very important. And of course, we do not want the sleep disorders, and we want identification of sleep disorders like sleep apnea or restless leg syndrome. Identify and recognize some of the symptoms, what's going on with your body. Maybe you tried a few different things to improve your sleep. You still don't feel charged, you're still tired and sleepy. Your partner is saying you're snoring. You have a headache in the morning when you wake up. Acid reflux maybe in the night. Maybe it's sleep apnea. So time to see a sleep provider. Get the testing done, home study or in-lab study, and get the treatment, because even though you follow all these behavioral life measures to improve and optimize your sleep, you still have to treat the underlying sleep disorder because they all are equally important. The recommendations for the sleep duration, we have a couple different organizations with different consensus. The National Sleep Foundation says for people ages 18 to 60, 7 to 9 hours of sleep is needed. And for older people ages 65 and above, 7 to 8 would be okay. Whereas I go with American Academy of Sleep Medicine practice parameters, where they say that 7 or greater than 7 hours of sleep per night is important for majority of the adults, particularly ages 18 to 60, because we know infants and children need more sleep. Adolescents, teenagers need more sleep. But talking globally about the adults, because we only have adults in this room here, so we all need 7 or more than 7 hours of sleep. And there has also been some research done where not only does less than 6 hours or less than 7 hours impact our health negatively, the same way people who get more than 9 hours of sleep or 10 hours, they also have health consequences. It can impact the heart negatively too. So the duration should be very optimal. You shouldn't be spending too much of time in the bed awake or sleep too much. Everything in moderation. So we know now all about the importance of sleep. There is so much of public awareness, so much of information in sleep and social media. How many people in the United States do you think are really getting that sufficient sleep of more than 7 hours? 1/3. that means 2/3 of the population is really not getting what is really needed. And then what do we see here? It's good news actually. Minnesota, 29% of the people in Minnesota, it's a low number. The lower the number, the better it is in this regard, that they say that they sleep 7 or less hours. So 29 is better when you compare to some other states like Hawaii. There, the percentage of people who say they are not getting sufficient sleep is 43%. So we are one of the healthy states then, right? Minnesota, Colorado, particularly if you go into depth, certain US counties like Boulder, Colorado. I don't know if anybody has been there. I have been. It is amazing. There, the people don't report that much of insufficient sleep. They're rated pretty good. Same thing in Vermont. What do we see in Kentucky and West Virginia? Very high, just like in Hawaii. And why is this happening? Why is this inequity or inequitable distribution of the sleep, and why are people getting some states good sleep and some not? Again, it depends upon the geographical location. Hawaii is wonderful for visitors to go and visit to escape the Minnesota winter. But the poor people who are living there, the indigenous people, with the hospitality, the resorts, the hotels, and all these things, they are constantly working. They are on a shift schedule. Some of them working, changing shifts, not even like a consistent. So they are obviously sleep deprived. What is happening in Kentucky, West Virginia? A lot of mining. Poor socioeconomic status, employment opportunities, all those things also have an impact on how much sleep you want. Because if you ask anybody, everybody wants to sleep, but there are challenges to be able to accomplish the goals. So, National Sleep Foundation a few years ago conducted a poll giving questionnaires to the people, adults mostly. And what they found interestingly was, among the people they did the survey on, 35% of people reported fitness and nutrition as their priority. 27% said work as their priority. And what did we see? Only 10% said sleep is their priority. So are we happy about that? No. So we want that number to go up, and I would be very happy if they reach that fitness nutrition, 35, or even more than the fitness nutrition, because if you are sleeping well, you will be fit too, and you'll have a healthy lifestyle. So now we know the importance of sleep. We learned about the consequences of not getting good sleep. How are we going to optimize it? What do we do? What are those interventions that we need to be aware of? What are some of these four well-known figures telling us? Well, let me start off with my favorite. I mean, I like all these people, but LeBron James is my favorite. I love basketball. So LeBron James has always said he gets 10 to 12 hours of sleep per day, and the way he says is he gets 8 hours of sleep at night and 2 to 3 hours of nap during the day. And it works for him, and he tells that is what is one of the secrets of his success. And now what does Bezos say? I know that I need to go to bed early, and I wake up early. I get good sleep of 8 hours. I tend to make sure that the meetings that need high IQ are only scheduled around 10 a.m. If there is an evening meeting, I'll move it to the morning time. Not now, not 3 p.m. Let's do it tomorrow morning at 10 o'clock. And he also says he exercises, and he makes sure that he spends time, quality time with children, try to have breakfast with them before they go to school. But how much is it possible? How many times are we really sitting down at a breakfast table and having a breakfast ourselves or with the family? Forget it. And sometimes we may not even have time to eat dinner with our family. But people are able to do it if we can. That will be wonderful. And what does Oprah say? She gets 8 hours of sleep. Does she use an alarm? No. She knows when she goes to bed, Her bedtime is always 10 p.m., always 6 a.m. And what does she do in the morning when she wakes up? Does she open her phone? No. She says that she washes her face, takes the dog out, exercises, and then starts her day. So that works for her. I mean, not that everybody has to wash their face, exercise, and all that stuff, but everybody, we have to figure out which is the most optimal. And Federer, he mentioned he was getting that 10 plus hours of sleep every day throughout his tennis career that make him very successful. So by using these people as examples, what I'm trying to tell you is we have to individualize what works for us and make sure that we recognize what is the condition which is good for us, what would be the appropriate bedtime for us, not forcing ourselves, staying up awake when we know we are tired and sleepy, and waking up at a regular time, establishing a consistency in the schedule. That was one of the other things to take away from these people is they had a consistent schedule, not like bedtime one way on work days and slipping off to a later time on a weekend. They were consistent regardless whether it was a season, if it is a sports season or not. So that was like very, very well determined, but we all could change some of it. We don't have to be a LeBron James. I can't be a LeBron James because I'm not a basketball player and I'm not tall enough to play, but I want to be efficient like how he is, right? So sleep hygiene is the most essential thing where we need to work on our behavioral and lifestyle modifications to improve our sleep. And where does the sleep hygiene start? With our phone. My phone is in my pocket. But I know that every time, like I know in the morning, I tell my patients not to look at my phone, but I myself do it. So I don't practice what I preach, unfortunately, sometimes. But I try to most of the times. So move the phone away. So move it, dim it, set it, lock it, and block it. Moving the phone away from your bed is good. You don't have to keep it close to you and have a loud noise that would disrupt you, and you will have a tendency that, oh, the phone is there, let me take a look at it. Anyway, I'm not sleeping, I might just surf what's going on in the news or in the world. And then dimming it is important. And now you just have the, one of the features inbuilt in the phone is how you can adjust the brightness. And there are some people who use special light filters. And some people tell that, oh, I use the Kindle. I don't use some bright light and I have a dimmer that's not too bright on me. But what does the research really say? The still there that even though there is this filters and all these e-devices and all that, no matter what you do, even the lightest amount of light exposure at night time for a person who wants to sleep at night can negatively impact their sleep. So screen time, I always tell my patients, avoid the screen time and using electronic devices the hour before bed and definitely not in the bed. And then set it. We always use our phones only as an alarm to wake us up. Well, we also could change another practice. Why don't we set up a time alerting us and cueing us is that so-and-so is our bedtime. Set an alarm or information there that 9 p.m. the phone alerts you that time to start getting to bed. But how many of us use it? Not many. It's mostly alarm purposes. And then lock it. Make sure that you have certain times, you have certain apps that can block you from surfing and going on and on, because once you are in that zone, you want to look what's next, and what is it going to do? It's going to decrease your melatonin production, it's going to activate and stimulate your brain, and you won't be able to sleep. Block it. In the night time, do not disturb or low volume instead of a loud ringing tone, maybe a vibratory mode. Like, again, is it feasible for everybody? Maybe not, because sometimes I'm on call. When I'm on call, I don't want my phone to be off. I have to, because I want to be, if I'm sleeping or something, I want to make sure I identify and I wake up and I respond to it. So we have to make certain modifications, but the sleep hygiene has a lot to do with our cell phones. The next thing to optimize sleep hygiene is understanding and aligning our circadian rhythm. We have a brain clock that is located in a structure called suprachiasmatic nucleus in the brain. That is the regulator of your sleep. That is the one that determines when you go to bed and when you have to wake up. So we have to make sure that we line them up well. So some of us are night people. Some of us could be morning people. Some of us say they are neither morning nor afternoon. So figure out which of the time of the day that you are most productive. A writer probably wants to do more activity and is perhaps more productive writing when everything is quiet, no disturbance, maybe night 11 o'clock or 12 o'clock. But if that person wants to go to work, is that a good choice? No. Again, with shift work, which has become like a common thing now worldwide, basically, with different shifts. It could be either a consistent shift schedule, common in healthcare, and then it could also be a rotating shift without giving the person sufficient time to switch on and off, moving to the next one. Like you can't jump off, putting the person today work evening, tomorrow come and report at 6 a.m. You're not giving that person enough time to reset. And then applying for jobs, we always should tell our people, apply for the jobs. If you're a night person, see if you can find something as a second shift or a third shift job. If you want. Again, some people say social life is disrupted. Oh, I want to be able to be there to see my children. I want to spend time with my wife. Again, I will say a billion things, but you have to figure out what really is feasible for you and how you can help yourself. That is the most important. Exposure to sunlight in the morning as soon as you wake up and a cup of coffee. I'm a coffee person. I haven't touched your coffee yet, but I'm going to later. So coffee in the morning is good, but light exposure in the evening, a couple hours before bed, can be negative to your sleep. What we see in summer times is so bright outside, so you can't really get easily the kids to sleep, and some of us don't get to sleep early enough because it's so light outside and we are active. We may be participating in activities like walking or tennis or pickleball, whatever. So we have to recognize the bedtime and make sure that we don't get that exposure to light before bed. And then the same way, minimizing the exposure to too much of bright light at night, working using your bright lamps. I tell my patients always to keep that area wherever they are within that couple hours before their goal bedtime dim, not too bright. So sunlight in the morning, low sunlight exposure and less bright light in the night before bed. And when I have people who are doing shift, I don't know how many of your clientele do shift work, working nights and evenings, but for my night shift workers, I clearly tell when you are returning home from work and it happens to be a bright sunny day, wear goggles. So that they will not wear the goggles when it is dark outside because it will make the vision bad, right? So when it is too bright, use sunglasses. So that it will help them to be able to get to bed because they are sleeping in the daytime. We want the lights dim, curtains and black shade, dark shades and everything to keep the room dark. Orange light glasses, you mentioned it, there are so many products in Google. When you look at the images, or Amazon has so many products. Whether I'm going to advocate them, I don't usually advocate them, but my patients already are using them one way or the other. Or all I tell them is, I use orange light, I should be fine. I say that there is no validated research that says that yes, it's going to be perfect, you're doing great, this is all you need to do, you'll be fine. No, it's not true. As I said, none of these are validated in research in long term as well. So even the lightest impact is going to be there for light. So the less screen time and avoiding screen time before bed would be good. But if some sort of an e-book and you want to use that light and it is working for you, I have no problem in that. I'm not going to take it away from them. Exercise. Now, Mike Jones, your expertise here. We all know exercise is very important to improve not only the sleep but also the mental health and the physical health. And aerobic resistance exercise in the morning or a high intensity exercise in the afternoon, all of these can be shown to promote nighttime sleep and improve your wakefulness and energy levels during the day. Now comes the question, am I going to tell my patients exercise in the morning as soon as you wake up like Oprah did? When they may not have the time because they're waking up at 6:30, they have to get the kids ready to school and be out of the house at 7:30. They probably will return home around 5 o'clock and sometimes they say, I take a short nap on my couch and then make dinner. Well, that time when you feel that you need a short nap, do some exercise activity rather than sleeping, because that can even impact your nighttime sleep. Or maybe there is somebody who only can work because of their work shift or work responsibilities or traveling for work and stuff like that. Maybe they only can go to a fitness center 8 p.m. and their bedtime is 10 p.m. Though I tell my patients not to sleep, exercise very close, like within the 2 to 3 hour window before their bed, I always tell them, well, if that is all you can, do it. Because you probably won't be able to sleep 1 or 2 times, but eventually you will have that drive to sleep in your brain accumulate, and I would rather want my patient to be able to exercise and work out than giving it up because of its association with sleep. So 9 p.m. works, go for it. Napping, very controversial area. There are some countries in the world where napping is normal and mandatory sometimes and is very essential. It works for them. In our society, there is no opportunity most of the times in a busy life. But the controversy, some of the theory is that you shouldn't be napping because if you nap, you won't be able to sleep at night. On the other hand, there is also evidence showing 20 to 30 minute nap, like a power nap, can be helpful. Probably it can help the person relax. It may promote them to be more awake and energized after their nap. But the key things that we should remember is when you are napping, set an alarm so that you will be able to wake yourself up within that 30-40 minute window, not sleeping for long hours, because if you sleep longer, you are going to get into deep sleep, and when you wake up from that deep sleep, boy, you're going to be confused, agitated, angry, and you don't feel good. And sometimes people say, I feel worse when I wake up from the nap. So you have to individual. So maybe a half-hour nap works for me. Maybe 10-minute nap is fine for you, and maybe you need 1 hour. But we have to make adjustments depending upon what works for you the best. For young individuals, midday nap is good. But for an elderly person who is taking multiple naps, that may have some negative associations that we have to be aware of. And for people who have bad insomnia, that they are on a bunch of sleep aids and antidepressant medications, they can't sleep. For them, I say, please don't nap, because if you are napping, your problem is only going to get intensified. Even the sleep aids and all may not be effective. How about alcohol, caffeine, and sleep? People use alcohol as a habit. Socially, they use it, and sometimes they use to relax, and some people use it as sleep aid. Unfortunately, alcohol is not to be used as a sleep aid. We recommend avoiding alcohol consumption within the 2 to 3 hours before bed, because alcohol can be easily metabolized. Of course, everything has to be in moderation in our life, right? Everything, including the hormones, the electrolytes in our body, everything has to be in our appropriate limits. It can't be too low, it can't be too high. So if you drink alcohol close to bedtime, it may perhaps help you to be able to relax and fall asleep quickly, but there is a tendency for us to wake up a couple hours later and have a hard time falling by better sleep. We call that as rebound insomnia. And sometimes it can worsen snoring and sleep apnea because it can relax your upper airway muscles. The muscles which are already relaxed when you sleep at night can close shut the airway, causing snoring and sleep apnea. Sometimes people have restlessness in their legs. Alcohol close to bed can worsen those restless legs. Caffeine. How many percent of population in the United States do you think take one form or the other of a caffeinated beverage a day? How about in the room, like less than 75, no, less than 50, 50 to 75, more than 75?
More than 75.
Right, 85%. And which is the topmost consumed caffeinated beverage? Coffee. So coffee should be always had in moderation too, whether it is a Diet Coke or coffee. 1 to 2 is always a limit. I have some patients who drink a case, like a dozen drinks until bedtime, and they say, oh, it doesn't affect me at all. I can just sleep fine with it, or I have to drink it. I have nothing, no negative effects from it. Unfortunately, the caffeine has a 6-hour half-life. So for a person who is drinking 1 to 2 caffeinated beverages a day, we want them to avoid drinking caffeine within the 6 hours before they go to bed. But that's going to change, right? If you drink more, it's going to take a long time to get eliminated from your system. So that even though you're drinking like 6 or 8 and telling yourself, oh, I'm not drinking anything within 6 hours, I'm fine. By 4, I'm stopping it all. Doesn't matter. The amount and the time when you stop is all important. What caffeine does to you is, it pulls you from the deep sleep, the N3 that I talked in my beginning slides, which is important to feel rested without your awareness. You may not even know about it, but we know it in the sleep lab when we use all those electrodes in the scalp to assess the brainwave activity with the EEGs and all that. We know how quickly a microarousal can happen with the effect of caffeine. And so we have to be very mindful of those sort of habits. So this is an essential part of hygiene too. How about diet? The key thing is never have a heavy diet, heavy meal within the 3-hour window at least before your bed. Because your food needs to be digested. And when is the physiological process, including digestion, active? When you're awake. The metabolism slows down once you sleep. So whatever food that you have eaten, if you're sleeping on a full stomach and not digested, it will make you gain weight. And sometimes if you sleep on a heavy meal, after a heavy meal, not spending too much time walking or exercising or being active, you also can have problems sleeping because depending upon the food you eat, supposing it is a high glycemic index, which can increase your blood sugar level, like high sugar or refined sugars, you won't be able to sleep. On the other hand, a fiber food or a fruit or a little vegetable snack, you'll be able to sleep. So you have to make the choices. A little small meal, a healthy meal, not too much, that is quickly digestible like a protein or a fat, would be good before bed. And for people who are doing evening shift, tell them not to make dinner and have it before they go to bed when they come home. Try to squeeze in some work time for a lunch and have it at your normal time and not after you come home. And the type of the food, if you are having acid reflux heartburn, try not to use any spicy food at night. And then try not to drink the alcohol or do not have dinner with caffeinated beverages or alcohol. So we have all these social media, we are very well aware of it. Every time there's something coming up, a DASH diet or a DII affecting the immunity or the Mediterranean diet. We believe in it, cardiologist believes in it, but the essential takeaways from it is try to focus your diet on healthy choices, protein, lean meat, and lots of vegetables, fruits, grains, and legumes. That should be your focus, whatever your dietary preferences could be. Now coming to the wearables the sleep trackers. This has become almost like a ubiquitous thing. All age groups nowadays have one form or the other of the wearable device. And there's so many more in the market. I can't even keep a track of it. In the beginning, when they started coming out during my career, I was able to remember all the names. But now, boy, if I did not look it up in the internet or anything in the news for 2 years or 1 year, there are so many more there. So they have their advantages. Some people like it to get some sort of a discipline that they incorporate in their routine. But there are also some people who get fixated on that. Boy, I'm getting very less deep sleep. I'm not getting REM sleep. So for those patients, I don't dismiss, because I respect my patients. I'm not going to say that what you're using is not good or not reliable. There is some reliability. I won't completely zero it out. The reliability comes in terms of going to bed, waking up in the morning, the sleep time, those sort of things, and the amount, rough estimate, all are pretty good. But when you say deep sleep, this much amount, REM sleep, that much amount, that is very unreliable. Because there is no scalp electrode or EEG monitoring with those devices that can definitively and accurately monitor your sleep staging, number one. Number two, each single device has a different algorithm by their manufacturers, and unfortunately, it is not open to public. We don't know what they use. You may use something, you may use something else, and at the end, they may all be different, and you can't compare apples to oranges. But for a person who says their sleep is very disrupted, and then they look at their wearable and they see that they are sleeping better, sleep seems to be a little bit hours, little bit increased, that's good. But again, if you get too fixated, it may raise your anxiety and make it even harder if you have insomnia. So don't get obsessed about it. As I pointed out in my earlier slides, in addition to all the things that we can do by ourselves, hygiene, duration, behavioral, lifestyle interventions, identifying the sleep disorders, getting to see the doctor in a timely fashion, getting the diagnosis and treatment if we have an underlying sleep disorder is very important. With this epidemic of obesity, there is a high prevalence of obstructive sleep apnea. Obstructive sleep apnea, again, it is very important to notice it because snoring can sometimes be noted as, oh, what's so new about it? I've always been told that I snore. It doesn't bother me. I sleep through the night. And they may not have a partner. But they should recognize that they have other things, a dry mouth in the morning or a morning headache, or they wake up more than one time in the night to use the bathroom to urinate, or they are tired, sleepy. Maybe that's what is going on, and so you have to get help. Because if you don't treat the sleep apnea, it can have negative effects on your health, including heart health, risk for accidents, and all that. Insomnia, if you tried everything possible, nothing works, and you feel miserable, it is affecting your daytime function, get help. Get an appointment to see a primary or a sleep doctor. If you have underlying depression or anxiety, it's important that you get that also optimally controlled, because if the anxiety and depression are not optimally controlled, sleep aids alone are not going to be helping at all. Restless leg symptoms, a creepy, crawly, anxious feeling when they go to bed at night when they are resting. If you notice it, take action, get help. Maybe your iron levels are low. Maybe you need to get the blood test and then start on iron pill after talking to the doctor. So identifying this is very important, recognizing. So the takeaways from this presentation are: sleep plays a fundamental role in promoting both physical and mental health. Consistent 7 to 8 hours of sleep per night is the ideal goal, and we should be aiming at it. Sleep hygiene and lifestyle modifications support your goal. Sleep disorders require attention and treatment. Thank you all for listening. And did I exceed my limit?
You did great. I gotta say, you've done something like a fun. I never take notes, and I took a ton of notes.
Thank you.
So you answered a bunch of questions that I had in your presentation. The one thing that you didn't address that I'm just curious about is now with, I think some people, even I talked to some people here, like are pulling back on the alcohol thing and they're going more into THC and cannabis. What role does THC and cannabis play in sleep?
So the THC and cannabis, there is like so much of confusion, and now with all this legalization and stuff, it is so easily accessible. A gummy is not like the gummy bears that you can do one or two like a snack like thing. When you don't know how many milligrams of that component is in that gummy that you take, and then you don't really know really clearly whether it is just the THC, the THC component itself in the cannabinoid, or is there another additive there which they don't really display that can have negative effects. We really don't know that. And with marijuana, which is available in these edible forms and all these things, we have to be very careful because it becomes like a recreational thing. For somebody who is using it maybe a couple times in a year when they're going on vacation with their friends, that is okay. But using it a couple times and as a sleep aid, I don't recommend, because there is a problem with the THC that it does not get metabolized quickly. It can last longer in your body. So if you do it one day and then you go and again another 2 weeks later or couple days later and do like in between like intermittent usage, you may also have what is called as a rebound insomnia, because like a withdrawal basically. There is that effect too. About 8 years ago or something, if I remember correctly, there was a small research study where they tried to use the marijuana THC components to help with the obstructive sleep apnea. That was totally dismissed to the point that the American Academy of Sleep Medicine had to issue a public statement, a position statement stating that this cannot be done because it is a small study with small mild cases of sleep apnea. It's not to be used for that purpose. After that came out, I had so many patients. When I have the marijuana, why should I need a CPAP? Doesn't work for that. I still have some patients for restless legs, they think the cannabis helps. It may or may not, but I don't really recommend them because they have their own negative consequences. Long-term effects, we don't know if they are dependent on that, it's unknown. Of course, if there is somebody with a chronic pain and has the medical cannabis for those reasons, it's fine. I'm not going to take it away from them.
Thank you so much. This
Of
is
course.
very educational. I have a quick question about the deep sleep. So is there significance of 10 p.m. to 2 a.m.? For example, if we go to bed at 8 and wake up at 4, so get the 8 hours of sleep, do we get the deep sleep from 8 to 12, or do we still get it at 10 to 2? So is there significance to
Yes.
10 to 2?
That is a very nice question actually. So as I said in my previous slides, it is a rhythmic process. Light sleep, which is N1, N2, deep sleep, N3, and then the REM, which is the deepest. So when you're saying deep sleep, I'm thinking that you're talking about the N3, which is needed for feeling restorative feeling or the refresh feeling in the morning. So we all have a tendency to spend a little more time in the lighter sleep stages in the first half of the night. The N3 can start off a little sooner, like within like 30 minutes or so after you have fallen asleep. REM sleep takes 90 minutes from the time you have fallen asleep to reach REM. So the deep sleep can be seen in the first half also, mostly. REM is mostly in the second half of your night, particularly robust in the early hours just before you finally wake up. That's why when people have these abnormal behaviors, we ask what is the time that is happening. Like a little kid might be crying or like screaming from a sleep terror at night. When does that happen? Usually, typically in the early first half. That is when the N3 is abundant. People have nightmares. When does that commonly happen? Second half of the night. REM is abundant. So the disruption is like, the subjective report that you tell me that you're waking up 3-4 times a night. And then,
Say, for like a one-time, go to the bathroom in the middle of the night, go back to sleep. There's a lot of people I know, including myself, where that's an issue.
that's totally fine. That is acceptable. It is a problem if you wake up more than once to use the bathroom, if you are less than 40 years age, and if you're not a diabetic, and if you're not consuming water right until bedtime. Beyond that, that means there is something else going on, like sleep apnea, where people have a tendency to urinate at night. To answer your question specifically, the sleep disruptions, we use a specific scientific term called arousal. We notice it when we do the sleep study, how briefly for a few seconds, like 3 seconds at all, just 3 seconds, a person is got sleep disruption where from any sleep stage they just come back awake and they fall back asleep. So ideally, the consensus is that you should not be having more than 20 per hour of your sleep. Up to 20 is still an acceptable norm with regards to the disruptions. The problem with the disruption comes when how much of time you are taking to go back to sleep. And we have to focus on what is called a sleep efficiency. Sleep efficiency at the end means how much time you have been asleep in relation to the total time in bed. Supposing I have you complete a sleep diary. You tell me that I went to bed at 10 o'clock and woke up at 8 o'clock. Means I would think that, boy, you got 10 hours of sleep, but you are telling me you only got 6 hours. But you're still in the bed. So efficiency is the one that you have to focus on. So 85% of the time that you are spending in the bed, if you are able to sleep well, that is golden. And again, there could be a night-to-night variability. We are human. Stress is inevitable. It is a part and parcel of our life. Vacations come back from vacation, reality. Speaking of that, I just got from vacation last week and I came into reality. So those are all transitions in our life. So we have to do the best we can. Did I answer that?
Yes, absolutely.
Yeah.
Thank you.
Yeah. Yes.
Okay.
Yeah.
Is it a myth that you can catch up on sleep? Like, right, you get lower amount one night and higher amount the next night. Does your body catch up, or is that not true?
The body definitely compensates. In fact, when a person is sleep deprived, the very first sleep stage that it compensates is by pushing you into that N3 sleep. And 48 to 72 hours after a long sleep disruption, you get into the REM sleep. There is a compensation, but as I have mentioned, adhering to one goal, making it like, consistency. You don't want to rely on a weekend. If you were to ask me, are you going to catch up with all that sleep loss, sleeping 5-6 hours Monday through Friday and sleeping 10, 11, 12 hours on a weekend? No, that's not true. Today is precious for today. Whatever damage metabolically it has happened with your glucose level and your body internally, physiologically for those 5 days, you're not going to eliminate it. What has happened has happened. So you shouldn't be reaching a point that you're only dependent on those weekend days to catch up. But if somebody is getting 7 and they are getting like 8 hours, I don't mind. Plus or minus 2, I don't mind. Yeah.
So, this happened to me today because my dog for some reason woke me up at 6:15 versus 6:30 or whatever. But sometimes, or go to the bathroom, like you'll wake up, like my alarm's set for 7, let's just say, and I'll wake up at 6:10, and I'm like, I feel super awake, feel great. I'm like, all right, well I still have 40 minutes, I'm gonna go back and lay down, and then I wake up at 7 and I feel less awake than I felt at 6.
So Stephen, right? So
Yeah.
Steve, you know what you should do under those circumstances?
That's my question.
Up and ready for the day.
Okay.
When you feel that way, just do it and get ready for the day. Don't go back.
Because you're not getting any real quality.
There's no benefit. In fact, if you say positive versus negative, the negative will be outweighing it. So when you feel that you have slept enough, do. The same token, supposing you wake up in the middle of the night and you're taking more than 15-20 minutes to fall back asleep, don't lay in the bed. Leave the bedroom, go to a different place of your house, whichever room you choose to. Keep the lights not bright, dim, and try to do something mellow, that is not doing dishwashing or laundry or preparing the meals and stuff like that, but something mellow, read, music, meditation, something like that to calm that mind and go to bed when you're really ready to sleep. Yes,
I have a question about snoring.
yes,
I snore.
yes.
And so, but it's not, I've always, as far as I know, I've always snored. And I don't think it's sleep apnea, but I know that there are negative effects of snoring and that like nasal breathing at night is better than mouth breathing. So what do you suggest or what do you have to say about just snoring without it being sleep apnea?
It's called primary snoring. So not everybody who snores has sleep apnea, though everybody with obstructive sleep apnea to some extent snore, which can be varying from person to person. So if you don't have the sleep apnea, that has been ruled out, and you don't have any daytime consequences like not feeling rested, feeling tired and sleepy during the day,
Right.
you must question yourself, what is the problem? Is it something with the deviated nasal septum? Is it allergies? Or is it something like a polyp? Or we call it as turbinate hypertrophy, because inside this part of the nose, inside there is some tissue that can develop like small tiny growths. They are very benign, but they bulge up and they have fluid fill in them, and so they block your passage. So if that is what is happening, there is resistance for the air to flow through, because their nostrils are the initial passage ports, right, of air entry. So that's probably what is happening. And of course, if you are not able to breathe through your nose, it is your body that is protecting you by giving you the alternate method of opening your mouth and sleeping.
Yeah, that's helpful. Thank you.
It's a timely issue for us. I went back to school. I have a 16-year-old, and his biggest complaint right now is getting up in the morning and being tired and whatnot. And I know there's been a lot of research around sleep in teenagers. How can I help coach him to get into a better sleep habit and not complain about being tired so much?
That's a common problem we see, that adolescents, teenagers often have very good, great, strong tendency to slip off to being a night person. They have no problem staying up in the night, and they have a hard time waking up. And you have to also understand, 3 months of summer vacation. Back home in India, we used to get 1 month. This is 3 months, man. Like you are totally like in a total different zone, and all of a sudden you start school. It's an adjustment. So we also know that screen time is so common among these kids as well. So if you could do something like the teenager needs at least, technically speaking, 9 hours. No less than 8 hours, because you need that sleep to be attentive at school and for your grades and concentration and everything from day to day, and probably you'll be driving too. So you have to make sure that sleep is important. So make sure you tell them not to use any computer or phone or other electronic devices screen time the hour before bed. Schoolwork is important, but don't do the schoolwork until your bedtime, because your mind is active. You need some downtime. We all need. That's not only the adults. Children need downtime too. And then have a set schedule and a set wake up time. And for your kid, what time does he have to wake up to go to school in the morning?
7.
So what I would say, how much time does he have from the time he wakes up until he's out of the house?
An hour.
So you can buy what is called as a bright light box for the kid. If you think he's really a night person, because you should remember, don't allow them to slip off into on the non-school days, like or a weekend or a holiday, that they go back to going to bed at 2 o'clock and waking up at noon. Try not to let that happen. They can sleep in, but instead of 7, maybe by 9, no matter, you should be up and ready. And try to purchase this light box. It's a very good gift that you can give to the kid. It should be of like 10,000 lux intensity. Amazon has it. from you while you're getting ready in the morning. So you're not dropping off anything to be into that light exposure. You're doing everything, like for example, I'm talking to you all, but I have my light box right here. It's shining on. So, and then the night time, not to keep the rooms too bright. Gently, because they don't like lecturing too, right? So 16-year-old, a boy, I don't know. There's going to be a pushback.
Yes.
Yes. Yes.
I'm tending in these cycles where I'll wake up at 3 o'clock every morning and then that's when my mind starts racing. Like, why is that and how do you break that? Is there...
It becomes like what is it? It becomes like a habit thing that we are conditioned that way. So if you don't recognize it and you start off ruminating and things like that, it becomes a vicious cycle. That's number one. Number two, active mind giving you a difficult time falling back asleep after awakening is very common. So for that, I tell my patients, including myself, that I try to do a little bit of a journaling or something, not close to bedtime. If my bedtime is 10:30, by 8:30, just spend 10-15 minutes in a cozy corner, just jot down the points A, B, C, or 1, 2, 3, what I need to do, and close it and put it in the app. Don't even think about it again. And do something to relax your mind. It's very important. Relaxation, stress reduction, those are all very important. And the once in a while, the 3 a.m. wake-up time could suggest a possible sleep apnea based on the timing, because the second half of the night is when you're perhaps having REM. Women and men too, for most part, have a high tendency for sleep apnea during REM sleep because our muscles are very vulnerable to obstruction. So awakening like a clockwork could sometimes signal that. So you have to recognize, do you have anything else going on? Are you waking up gasping, choking? How long does it take for you to fall back asleep? Did anything happen before that this pattern started? Are you able to identify a stressor and work around it and get help if you need? Yes.
What time should we stop drinking water generally before bed? Like an hour or two? Or
An hour before bed, I would not, just that hour before bed, you shouldn't do. Because most people usually use the restroom, common phenomenon, as they are preparing to their bed. Yes.
And then what's your opinion about mouth tape? Is that help or is it good marketing?
It's a marketing thing. I feel I don't even like when my patients tell that, I feel like, oh God, what are you doing to yourself? Like, you know. So it's not going to completely resolve the problem. It's just the marketing. And then you also, Chris, had a question about the wearable devices, and I asked you to save it for it. What is the question?
Yeah, well, actually you answered it, so it's good.
Thank you. Thank you.
Good job.
Yeah.
I have tested method. I drink warm water right before bed.
You have been tested what?
Somebody suggested drinking warm water before bed, and I don't wake up during the night versus cold water, so maybe that's something you want to try. It works for me, so.
So that's what I said. So
Oh, sorry.
there is nothing like what do you call like a gold standard recommendation there. If you find it helpful and it works for you, you can do it. But am I going to tell everybody to do that? Maybe even if you're a twin sister and you told your twin sister to do that, it may not benefit her at all. So it's just personalized approaches and recognizing them.
Say there's a person who for years, maybe even decades, had suboptimal sleep, not enough hours, not like 4 or 5 hours a night. So therefore they're not their brain not detoxing, all the things that you said that is a good sleep. And then is there permanent damage, if you will, or would that healthy sleep restore that? What's the effect or impact on that over decades, and can that be reversed?
Yes, that's a very nice question. So you're talking about acute short-term versus a chronic problem which has gone for decades. That is something that you can't really reverse the whole damage, but they can have these problems that could be their diabetes, or they can start having irritability, mood problems, or memory issues, attention span. They all will be happening. But at least by recognizing at some point and the awareness, and from now this is what I'm going to do, will prevent the progression or further damage. Does that help? Yes. That all the damage, how is it going to do? All has happened. We can't unchange it. But if you do something to change, you will prevent the future damage. You may not be able to completely reverse, because all those have strong effects on our body. And unfortunately, this is all like so silent. It is not something we can recognize, right? We have a bug bite. Yes, we know it is itching. It's become red. So we know that we should put some cream or something or to take care of it. Whereas with sleep, how much time do you think? Like only 10% showed priority with sleep. So they may not even occur to them that they are not sleeping. That's why they are having these issues. Trauma.
Yeah, so because you had said, it was very interesting how the amygdala, is easily accessible in sleep. And so negative memories are stored here. So if someone has experienced severe trauma in their life, I'm imagining they suffer with sleep, right?
Oh, yes.
So what do you recommend for someone who has experienced severe trauma to improve sleep?
So trauma is pretty common in the veteran population that we often see among the case discussions, and I also have some people in the military or other, there could be other traumas too, like victims of violence and everything. There is this element of post-traumatic stress disorder, PTSD. Remember, not everybody carries the diagnosis. Not everybody gets the medical attention or diagnosis and management. Trauma definitely impacts sleep. It becomes what is called as, supposing there is an event, for example, that happened around their bedtime. So maybe like a burglary or something, or they were attacked or something at that time. That incident may have happened 20 years ago. But boy, till today, that person around that 10 o'clock has that intense emotion that they can't really sleep, and they go through that. So for those patients, what we always recommend is, again, this PTSD can manifest in so many ways. I'm just focusing on the sleep part, the insomnia part. We tell them to see a sleep psychology. There are so many psychologists, but there is very few sleep psychologists with their expertise just to offer what is called as cognitive behavioral therapy, CBT, so that they can improve their sleep by cognitive restructuring. And supposing it is a victim of rape or domestic violence and things like that, or very bad trauma from things, there is also a component called image reversal therapy that is offered by special psychologists. It's called IRT.
Let's hear it for Dr. Sagar.